Liposuction is one of the most common surgeries that I perform. With the right techniques in the operating room and the right post-operative pain management plan, liposuction can be very tolerable and very comfortable. I use a specific medication in the operating room prior to performing the liposuction that helps treat pain while I'm performing the surgery. And then I always send pain medications to the patient to take after surgery, because the first couple days they'll be sore, but it's nothing, out of the ordinary. I always make sure that they're comfortable. I check in with them. If their pain is worse than expected, I could always send other medications or kind of alter my plan. But that's why it's really important to go to somebody who does these procedures regularly and has the right plan before surgery, during, and afterwards. Some patients, they're afraid prior to surgery, or they have a little anxiety prior to surgery, and that's completely normal. I like to see these patients sometimes multiple times prior to surgery, because I like to reassure them of what to expect afterwards. And oftentimes I'll have patients tell me it's not as bad as I thought it would be. And that's because during surgery we use specific medications, specific techniques while we perform the surgery to help patients recover in a much kind of more comfortable way immediately afterwards. So oftentimes patients will tell me it actually wasn't that bad, and your description of the surgery and what I should expect after was kind of right on the money. Sometimes I'll get patients, for example, it'll be a female who's very active, leads a very healthy lifestyle, exercises, eats very healthy, but sometimes will point out that her love handles or her abdominal region just has stubborn fat that she can't get rid of, no matter how much cardio she does, how many times she goes to the gym, or how many sit-ups she does. And in that patient who's leading a healthy lifestyle, who has realistic expectations, liposuction can really give them really dramatic results, really treat those areas that they're not able to kind of take care of on their own. So the definition of lipectomy is really just the removal of fatty tissue, and we can accomplish this in different methods. So one of the ways we can remove fatty tissue is surgically to remove it. This is commonly done in body contouring surgery in patients after weight loss or massive weight loss, and one of the methods is a belt lipectomy, which means removal of fatty tissue around the abdomen and all the way around the back in a circumferential fashion. The other method for removal of fatty tissue is commonly known as suction-assisted lipectomy, which is, most people know it as liposuction. And what we do there is, using a cannula through very small, tiny incisions, we specifically target certain layers of fatty tissue underneath the skin to contour the body. And really the best way to go about figuring out which procedure is best for you is have a consult with a plastic surgeon who's going to describe the different procedures, evaluate your skin, evaluate your body, and give you his or her best recommendation. So a surgical belt lipectomy versus liposuction, those are two completely different procedures with different recoveries. A belt lipectomy requires an incision and the surgical removal of skin as well as fatty tissue circumferentially, which requires then suturing the wound back together. That'll lead to a little bit of a prolonged recovery compared to liposuction, because in liposuction we're making a couple very small 1 to 2 centimeter incisions and using a cannula to suction out the fatty tissue. So there's really not a prolonged recovery with liposuction because there's not huge wounds to deal with. One of the most common areas that I'll perform liposuction is the neck. I'll evaluate patients who come in and they say they just have a little bit of kind of stubborn fat or fullness of their neck, and they just want a more defined jawline and appearance of their neck. And of course, during the consultation, I'll see if just doing liposuction is really the best option for them. But that's one of the most common areas. The next most common area that I'll perform liposuction is really kind of the chest on males who sometimes feel they have a little bit of stubborn fat in their chest. We can perform liposuction sometimes just alone and really get a very nice toned result. And then of course the other most common areas that we perform liposuction is the abdomen as well as the back. And one of the things that I tell patients, sometimes even who are presenting to me for a tummy tuck surgery, is I'll tell them the tummy tuck is the front. We can get that really nice and tight, but your back really is going to accentuate your results. So often I'll recommend liposuction of the back in addition to their tummy tuck surgery. And that really gives them that very nice hourglass silhouette, really creates nice curves, because I think if you don't treat the back, you're really not getting a complete look sometimes. And it really all depends on the individual patient. Liposuction is a body contouring surgery. Oftentimes I'll tell patients, in fact, it's very important to get to your target weight. and to be within about 10 to 15 pounds, whether that's above or below your target weight prior to undergoing liposuction surgery. And it's also very important to keep that weight stable for at least 6 months. And the reason for that is when we're performing liposuction, we're contouring the body to the frame and your current weight. So if we perform liposuction surgery and you either gain 30, 40 pounds or lose 30, 40 pounds after surgery, it's really going to compromise your results. So that's why it's very important to hit a target weight, keep it stable for at least 6 months, and then seek a plastic surgeon who can give you their best recommendation and perform liposuction, which again is body contouring surgery. It is not weight loss surgery. When I tell patients that I want them at a target weight prior to performing any body contouring surgery, such as liposuction, really what I mean is, let's say for example, a patient's target weight is 150 pounds, and that patient at the moment weighs 200 pounds. So liposuction surgery is not a weight loss surgery. In that specific example, the patient would not be a candidate for liposuction. But instead, what I like to do is I like to give them all the resources to help them lose weight, whether that's diet, exercise, see a nutritionist. And then when they're about 10 to 15 pounds within their goal weight, so in this example, we're looking at anywhere between 150 to 165 pounds, and they're stable at that weight for 6 months and they're happy, I think at that point they become a candidate for body contouring surgery such as liposuction to give them really the best results and long-lasting results. Biggest things in my practice that I see is some patients want liposuction surgery and they may not be a candidate for it, and other patients think they want other surgical procedures and they're actually a better candidate for liposuction. It's really important to see and speak with a plastic surgeon so you can be evaluated prior to any surgical procedure. In my practice, one of the big things I see is patients may have a lot of extra skin or hanging skin, especially if the skin is damaged from the undersurface. Sometimes I tell them liposuction might not be the best option for them because after we perform liposuction and we empty out that space underneath the skin, they'll be left with extra loose hanging skin on top of it, which I don't think is a aesthetically pleasing look. I like to speak to patients one-on-one. I like to show them photos. I like to really give them realistic expectations so that we can together make the best informed decision for them. Some patients I'll see in my office and come to me and say that they want, for example, like a tummy tuck surgery, which is an abdominoplasty. And really, I like to evaluate them. I want to make sure that their core muscles either are together or they're separated. I like to evaluate their skin quality. Is the skin stretched out? Is it damaged? Or do they have really nice, firm, tight skin that I think can snap back after a liposuction procedure? And then I evaluate the fatty layer in between the muscle and the skin to see how much fatty tissue they have. Sometimes patients come and say they think the only option is a tummy tuck, and I'll tell them, what, your core muscles are really nice and tight. I don't think they're separated. Your skin quality is excellent. You just have that kind of stubborn fat in between the two, and undergoing a liposuction procedure is actually a better option for you, which is obviously a less invasive surgery than a tummy tuck. The difference between liposuction and an abdominoplasty, which is commonly known as a tummy tuck, is pretty great. They're two completely different surgeries. With liposuction, we're just making 2 to 3 small incisions, depending on the area that we're treating, and we're using a cannula to suction out the fat. We're not treating the skin, and we're not treating the underlying musculature. With a tummy tuck, what we're doing is we're making an incision, and we're kind of lifting all of that skin and fatty layer up. And really, one of the big components of a tummy tuck is repairing the muscle. So your muscles kind of here in the middle of your abdomen can sometimes get stretched out, especially commonly in women after pregnancy. And so it's very important to repair those muscles, and that gives you that nice flat waist. And then what we do is we re-drape all that skin and fatty tissue over that. There's usually an extra amount of skin and fatty tissue that we excise, and then we suture the wound together. So they're two completely different operations. They treat different parts of the anatomic abdominal wall. Like I said, liposuction is just treating the fatty layer, whereas a tummy tuck is treating the skin, the fat, and the muscle. And that's really important for patients to know. When I see patients and they may come to me and they think that the best surgical option for them is a tummy tuck, after I evaluate them, a better option is actually a less invasive option, which is liposuction, I will tell them that, and I'll tell them the expectations from the two different procedures. I'll tell them that they have really nice skin quality, their muscles are not separated, their core muscles, and they just have some fat kind of in between the two. And I'll tell them that liposuction is actually a great option for them. It's a quicker recovery, it's a less invasive surgery, but really it comes down to the surgeon and the patient creating expectations and making a decision together. One of the most common consults I'll see in my practice is patients who are unsure if they're candidates for liposuction or an abdominoplasty, which is commonly known as a tummy tuck. And really the best way to know which one is best for you is to see a trained plastic surgeon who can evaluate you in a consultation, do a physical exam of your skin, your abdominal area, and really give you their best recommendation of what they recommend for you. As far as the two surgeries, liposuction and an abdominoplasty are two completely different operations with different expectations and different recovery. In liposuction, what we're doing is we're making very small entry point incisions for a cannula, and we're using a cannula to just suction out fatty tissue. But really kind of determines who's a candidate for liposuction is you need a good core underneath that fatty layer. So you need your muscles to be nice and tight, and you need your skin quality to be pretty good. Because if your skin is damaged or kind of stretched out or hanging over, just doing liposuction will actually potentially make that skin hang look even worse, which is not ideal. As far as a tummy tuck, which is known as an abdominoplasty, there's really three components to the operation. One is we're treating the skin. Number two, we're treating the fatty layer underneath the skin. And number three is we're treating the core abdominal muscles underneath the fatty layer. So patients who typically will present for a tummy tuck are females who have had multiple pregnancies and kind of their core muscles, their abdominal muscles are stretched out and separated. And what that does is it creates an appearance of a widened waist. So what we do is we make an incision that we hide very low in the bikini line so that nobody can see it. And we raise all that extra skin and fat on top of the abdominal wall, and we isolate those separated muscles. And then what we do is we repair those muscles, suture them together, make them tight. That kind of flattens the abdominal wall and really brings in the waist to create that hourglass figure. And then we re-drape all that extra skin and fat, and we excise whatever is extra, and then we suture the wound back together. And again, we really focus on keeping that incision very, very low and try to keep that scar as thin as possible. One of the most common questions that I'll get in my practice is, what are the most common side effects of liposuction? And really, the most common side effects are bruising, which is completely normal and will typically resolve within the first week after surgery. Swelling, which is completely expected, and that's the reason why I highly recommend compression garments and starting post-operative massages. And then, of course, the other most common is pain. And what we do in the operating room is we use certain techniques and medications to try to lessen that pain when the patient wakes up. And of course, I always send pain medications to the patient's pharmacy prior to surgery so that they can have it readily available when they get home. Swelling, bruising, and pain can last for sometimes a week after surgery for pain, sometimes a couple days after surgery. It really depends on the individual patient. I usually tell them the first couple days after surgery are the most uncomfortable, but once they hit that 1 week mark, they really start to feel a lot better from a pain perspective. Bruising, kind of the same thing. Sometimes some patients bruise really well, where after surgery they're very mild bruising. Others tend to bruise a little more. So same thing there. I would say at a week, the bruising starts to get a lot better. At about 2 to 3 weeks, it's greatly improved. And swelling is really one of the most common side effects after liposuction. That can last for weeks or even months, and that's why it's really critical to continue to wear your compression garment and continue to attend your post-operative massages, that are recommended by your plastic surgeon. Can I gain weight after liposuction surgery? And the answer to that is definitely 100% yes. That's why it's really important prior to undergoing any body contouring surgery, such as liposuction, that you're really mentally and physically ready with your lifestyle prior to undergoing surgery. And the reason for that is it's going to give you best results over a long period of time. Patients, after you undergo liposuction surgery, if you're already eating healthy, you're exercising, you're at your kind of target weight, but there's really just some stubborn areas of fat that you can't get rid of, then you're a perfect candidate for liposuction surgery. But if you're kind of not eating healthy, you're not leading a healthy lifestyle, you undergo body contouring surgery, there's always a great chance that you're going to gain weight, or you can even lose a lot of weight. And either of the two can compromise your results in the long run. Some of the most common complications after performing liposuction surgery are really pain, which is controlled with medications and typically is much improved after the first couple days or the first week of surgery. But really the other two biggest complications, or really expected outcomes, are swelling and bruising. And those are greatly decreased with compression garments as well as post-operative massages. Just like any other surgical procedure, there's always other potential risks like bleedings or infection. But if you go to a trained plastic surgeon who performs these procedures regularly, the risks are very low, and that's why I always tell patients it's really important to do your research and go to a trained plastic surgeon for any plastic surgery procedure. One of the most common questions I'll get from patients prior to undergoing liposuction surgery is, what can I expect immediately after surgery? What am I going to feel like? And the most common things that a patient's going to feel is definitely some soreness the first couple days or even the first week after surgery, bruising that's completely normal, and swelling. And these are probably the three most common expected outcomes after liposuction surgery. But typically with pain medication, sticking to your compression garment as recommended by your plastic surgeon, and sticking to post-operative massages as also recommended by your plastic surgeon, they'll be greatly improved within the first couple of weeks of surgery, and patients will typically do very well. So recently I had a patient who underwent liposuction surgery. The patient was a female in her 40s, and her recovery went pretty great. Yeah, the first couple of days she was sore. If you perform liposuction kind of in the wrong layers or just under the skin, or somebody who's not well trained in liposuction, it can really create some skin irregularities and some scarring underneath that's then very difficult to fix, if even possible at all. So that's why I always recommend go to a trained plastic surgeon who knows the correct technique of where and how to perform liposuction. One of the big misconceptions with liposuction is that it's a painless procedure or something that you can get done in the morning and then kind of just go right back to your regular lifestyle right after. But liposuction is a surgical procedure. It definitely is associated with some pain, but what we do to mitigate that pain is we use certain techniques in the operating room as well as post-operative medications to make the patient more comfortable. Prior to undergoing liposuction, I usually tell patients what to expect, what their recovery is going to be like, and I think it's very important to have a support system at home who's going to help and take care of them as well. So one of my favorite aspects of performing liposuction on patients is really their kind of post-operative recovery and seeing them through the entire recovery process. And one of the things that I love to see is as a couple of weeks pass by and the swelling comes down and their massages are going great, and they start to look in the mirror, they start to really see the silhouette that I created with liposuction. And one example of that is I recently had a patient who we did 360-degree liposuction, which means the front and the back. And she's a couple weeks out, and she recently was at a big family Thanksgiving party, and she was showing me pictures of her and her clothing and how confident she looked and how all her family said, "Oh my God, you look so great." So that's definitely one of the most rewarding parts of my profession, is just seeing patients regain the confidence that they always had. We're just tweaking it, that's all. Prior to performing liposuction, what we do is we actually inject a fluid in the areas that we're going to perform liposuction, and that fluid contains two things. One is lidocaine, which helps with pain during surgery. The other is epinephrine, and epinephrine helps clamp down on the blood vessels, so there's very minimal blood loss prior to liposuction. After we have that fluid in, what we do is we start to perform liposuction, and what that usually entails is there's a cannula and it's attached to a suction system. So then once it's entered in specific areas that we're trying to remove fat, it suctions out the fat cells. And it's not just kind of randomly sucking out fat in areas, but it's really important to go to a plastic surgeon because there's different layers of the fat under the skin, and you really want to target those specific layers to get the best body contouring result that you can get. One of the most common questions that I'll get from patients regarding liposuction surgery is how much fat can be removed. And this goes back to one of the core principles that I think every plastic surgeon practices, and that's safety. The maximum amount of volume we're allowed to take off is 5 liters. So I never remove more than 5 liters. Now with that said, every patient is unique. Some patients you only need a couple 100 milliliters. Some patients may require 2 to 3 liters of fat removal. It really depends on what areas we're treating, how many areas we're treating, what is the patient's goal prior to surgery. So that's why it's very important to undergo a consultation prior to surgery with your plastic surgeon so that you can have realistic expectations. Liposuction is one of the most common surgeries that I perform. Liposuction is very safe as long as you go to the right surgeon. So after liposuction surgery, the first couple days after surgery, patients will be quite sore, but it'll be controlled with medications that we give patients prior to surgery. After the first 2 weeks of surgery, patients will feel much improved. At this point, they're wearing their compression garment, they're undergoing their post-operative massages. At about 2 weeks, I would have already told them they can go back to work as long as they're doing light duty. They exercise, I tell them they could start light aerobics. It'll probably be a little too early for them to start lifting any heavy weight at that point. And then at about the 6-week mark, patients usually are doing great at this point. They're continuing with their compression garment, their post-operative massages, they're back at work. At this point, they're fully back at the gym without restrictions. But really, what I tell patients is, at about the 6-month mark is where a lot of the swelling will be down and you could start seeing the final result of what we created with the liposuction. But it takes about 6 months to a year to really see the final result, the body contouring procedure. Most of the times patients might have a lot of anxiety or be kind of afraid of surgery, and that's completely normal. And usually what they're afraid of is how are they going to feel afterwards? Is it going to be very painful? And sometimes I'll see these patients and I'll talk to them multiple times prior to surgery. I'll reassure them of what our goals are during surgery, what are my techniques. Sometimes I use specific medications after surgery to make them feel better, and I always use a medication during surgery while I'm performing liposuction that helps treat pain. And usually patients after surgery will tell me that it's not as bad as they expected. They're actually very comfortable. First couple days they'll be sore, and that's completely expected. But with the right pain medication regimen, very tolerable, and they do very well. Liposuction removes fat cells from targeted areas, and once the fat cells are removed, they cannot grow back. Now, with that said, as a patient either loses weight or gains weight, the remaining fat cells in the body can definitely get larger or smaller. So as far as removal of fatty tissue, liposuction is permanent. That fatty tissue will not grow back. But I always instruct patients, prior to surgery, you want to kind of have a very healthy lifestyle with nutrition and exercise, and it's very important to maintain that after surgery because that'll give you optimal results in the long run. An example of a patient who I performed liposuction on who was very happy afterwards was somebody I saw before surgery. She's a mother, she's had multiple children, and she just had a couple areas on her back and on her abdomen as well as around her waist that were just troublesome and bothering her. When she would put on a dress, she felt like she just wasn't looking as good as she would like to. So what we did is we came up with a plan together of certain areas that we could treat with liposuction. And in the first week after surgery, I told her swelling and bruising is completely normal. But after the first 2-3 weeks, she started to continue with her post-operative massages. She started to really see the shape that was created, and she started to see curves again, and she was slim. And as far as putting on a dress, she was a couple of weeks later very happy and seeing the curves that she had prior to multiple pregnancies. Liposuction is a cosmetic surgery, and the goal of liposuction is to create the ideal aesthetic for each individual patient undergoing a body contouring surgery. Liposuction is not emergent surgery, it's not required, you don't have to get liposuction. And that's why I like to see patients during the consultation. I like to ask them, what are their goals? It's really important that the surgeon and the patient are on the same page to see what is an expected realistic outcome. But liposuction in the right patient can be a great surgery because it treats stubborn areas, but the patient has to be mentally prepared to undergo the procedure. It's not a small procedure, it is a legitimate surgery. A day after liposuction surgery, I usually tell patients what they can expect is they'll be in a compression garment because they'll wake up with one on after surgery. I'll have had sent them pain medication because they'll probably be a little bit sore the day after surgery. They'll have some swelling that's completely normal and expected after liposuction surgery. But really the day after surgery, what I tell patients is hydrate, walk as much as you can, really no strenuous activity because that's gonna kind of increase their pain and make them uncomfortable. And really I like patients to have a support system at home, whether that's family or friends, that can, help them around the house, whether it's making something to eat or ordering food or whatever it is. But usually it's the first couple days after surgery that patients are a little sore and can be a little bit uncomfortable. Some examples of strenuous activity that I want patients to avoid is really lifting anything above 10 or 15 pounds. But if they're home, using the bathroom should not be an issue. Even if making themselves something to eat should not be an issue. And every patient's different. Some patients will be a little more sore than others and need a little more help around the house, and that's completely fine. And other patients the day after surgery will say that they were able to kind of cook and do little small chores around the house and their pain was well controlled with medications and they felt great. It's really up to each individual patient. Everybody heals differently. There's a different amount of liposuction performed on every patient. Not every patient is one and the same. But what I tell them in general, you can expect to be a little sore for the first couple days, but nothing out of the ordinary. Wear your compression garment, hydrate, eat food, and really walk around the house. That's really important after any surgery. After liposuction surgery, I'll tell patients immediately after surgery, walking around is really important. And what I kind of tell them is every hour, try to do kind of a lap around your house. And then afterwards, you can sit down. And that's really important for any type of surgery that I perform. I want patients up, moving, and walking immediately after surgery. After liposuction surgery, your body heals from the inside. It is traumatic. We're performing any type of surgery. We're traumatizing some of the tissue, obviously strategically. And your body kind of just repairs areas that are traumatized. And the skin will typically re-drape over the area where we perform liposuction, where we remove the fat under the skin. And we specifically target specific layers of fat under the skin to contour the body as nicely and aesthetically pleasing as possible. After liposuction, I like to tell my patients what their recovery process is going to be like. I usually tell patients for the first couple days they're going to be a little bit uncomfortable, but with pain medication and a compression garment, they'll do pretty well. And I always tell them it's very important to have some help at home for the first kind of week after surgery. As far as taking time off of work, I usually recommend patients take about a week off of work. I see patients first couple days after surgery, I see them a week after surgery, and they're usually feeling pretty well at about a week after liposuction surgery. What's also really important in the recovery process is post-operative massages after liposuction. The reason for that is liposuction creates some swelling and it can cause some fluid where we're doing the liposuction, and post-operative massages really help to get that fluid out and really smooth out that contour in the initial post-operative period. Post-operative massages are really crucial, in my opinion, after liposuction surgery. And the reason for that is it really helps mitigate and lessen the swelling after surgery. One of the benefits of our practice at SY Aesthetics is that in the office have a masseuse as well. So the patient comes after surgery and starts getting their post-op massages. And I'm right there as well in the office, so I always kind of say hello to the patient, peek into the room, look at all the areas where we perform liposuction as the patient's getting their massage. So I can always see kind of the results of the massage kind of developing. So if there's any questions at the time, I'm right there. They can always ask me, rather than a patient going to a different location where they're getting massages and the surgeon's not readily available there. So I think that's definitely one of the benefits of our practice. The first week after liposuction surgery, I usually tell patients following are their expectations. Take off a week from work. The first couple days you'll be pretty sore, but again, post-operative medications will make you feel a lot more comfortable. Actually, I promote walking. It's very important after surgery. You could do light things around the house. Every patient's really different. That's why I think surgery is very individualized. Some patients recover a lot quicker and some just feel sore for a couple more days than others. It's really important also, I tell patients to come see me after surgery, of course, because I want to make sure everything's looking great. And within that first week, I really emphasize that they begin their post-operative massages, because it's really important to help lessen the swelling. And of course, the compression garment, tell them to start wearing that. We actually put it on immediately after surgery. Compression garment after liposuction surgery, I think, is really crucial in the healing process. And what the compression does is where we perform liposuction, it kind of compresses that space down, so it prevents fluid from accumulating. Fluid is going to accumulate after liposuction surgery, it always will. But a compression garment helps lessen that fluid and kind of helps compress those spaces down so no fluid really builds up over time. As far as gym or strenuous activity, I'll tell patients usually it's about 2 to 3 weeks until they can get back to the gym, and everybody's kind of different. I tell them you could start with light aerobic exercise, walking on the treadmill, whether that's an incline or just kind of calmly walking. I don't think running full speed 2 weeks after liposuction surgery is something that they'll even want to do on their own. But usually first 2 weeks, I would tell them just relax and probably not going to want to do much. But after 2 weeks and compression garment and post-operative massages, once that swelling and starts to come down and their pain's well controlled, they'll usually want to get back into the gym and at least start doing some light walking. After liposuction surgery, patients will commonly ask, what can I expect at about the 4-week mark? And what I'll tell them is, pain-wise, they'll be a lot more comfortable. They should be back at work. By that time, they should be back in the gym exercising if that's something that they like to do. That can only help their results. They will still be in the compression garment. I usually recommend that from anywhere between 3 to 6 months. They can still have some swelling, and that's normal at 1 month. But I usually tell patients, for them to see their kind of final result, it usually takes about at least 6 months to see the final result of liposuction and kind of the way the body's going to be contoured. One of the most common questions I'll get from patients is, after liposuction, the fat that's removed, can it grow back? And the short answer to that is no. The fat cells, once they're removed, cannot grow back. However, if a patient loses or gains weight, the fat cells that remain in the remainder of the body can change. So where we suction the fat from, that fatty layer cannot grow back. But the cells that are nearby, that are left behind, can get larger or can get smaller, depending with weight loss or weight gain of the patient. What I tell patients is really important is we put the compression garment on immediately after surgery, and I tell them to continue to wear that because that really helps with post-operative swelling. And then within a week after surgery, we usually start post-operative massages in our office where I also see the patient. And that again helps really speed up the healing process and decrease the amount of fluid and swelling that builds up underneath. Sometimes patients will put on the compression garment and they'll get home and they may feel uncomfortable or they just don't like it, so they'll take the compression garment off. They won't follow post-operative instructions for post-operative massages. That's not ideal, but it's not gonna ruin your surgery, but what it does is it really slows down the healing process. So they'll have more fluid accumulation where we perform the liposuction, and sometimes that fluid can build up and will need to be drained in the office. If they don't wear the compression garment, what that also does is it really increases the amount of time that their swelling will be present for. They'll be greatly improved within the first couple of weeks of surgery, and patients will typically do very well. So recently I had a patient who underwent liposuction surgery. The patient was a female in her 40s, and her recovery went pretty great. Yeah, the first couple of days she was sore, had some discomfort that was controlled with medications, but that was expected. She continued to wear her compression garment, and she began her post-operative massages at about a week after surgery. But after a week, she said she felt much better. She was able to do things around the house. She felt like she could go back to work. These are really kind of the expected outcomes that most patients experience after liposuction surgery. After performing liposuction, what's included in part of the surgical process is patients are gonna wake up with a compression garment that we provide. They're gonna see me after surgery many times, included in the process, and I always love to see my patients through the healing process. Patients also get post-operative massages performed at our practice. That's included as well. So it really kind of helps take off some of the anxiety or stress, some of the burden off the patient for thinking, where am I going to find the garment, or where am I going to get a massage? Will I even see the surgeon after surgery? All those are included. Take that very seriously as well. So after liposuction surgery, what I recommend as far as hydration and nutrition is definitely drink plenty of fluids after liposuction surgery. That's very important, whether that's water or Gatorade. If you want to add some electrolytes into your beverages, that's totally fine. And then as far as food, I tell patients try to maintain a healthy diet. So that means fruits, vegetables, and protein-rich foods, because proteins are kind of the building blocks and help repair any kind of damaged tissue. So it really speeds up the healing process. What I tell patients to avoid is really stay away from high sugary foods, kind of high carbohydrate foods, anything that's going to really peak your sugar levels really high. One of the other things that I'll recommend to patients is if they like, they can get pineapple, and the reason for that is pineapple contains something called bromelain, and really that's an anti-inflammatory marker that'll kind of help speed up the process. After any surgery, or even specifically liposuction surgery, if patients kind of after surgery are not hydrating well or not eating healthy foods and really eating fast food or high sugary foods, it's just going to make them feel worse after surgery. So their recovery is going to also kind of go hand in hand with the way that they're feeling. So that's why I tell patients hydration and healthy diet is not only crucial to their lifestyle normally, but in a post-operative period, if they're feeling great, they have a good balanced nutrition, I think that the healing process goes hand in hand with that as well. So after liposuction surgery, patients will sometimes ask very general questions about just regular things that they do in their life, and one of them will be, how do I sleep after liposuction? And what I tell patients is they're going to wake up in a compression garment and continue wearing that after surgery. And then as far as going to sleep, most patients will kind of figure out where they feel comfortable. It also depends on the areas we perform liposuction. But assuming that we perform liposuction, for example, on the abdomen, patients will usually feel most comfortable sleeping on their back. Sometimes I'll tell them they're a little sore, maybe putting a couple pillows behind, their head to kind of lift them up a little bit might make them feel better. Sometimes putting a couple pillows under their legs to elevate their legs a little bit might make them feel better. But patients are usually pretty good at figuring out what's the most comfortable position for them to be in. But there's really no restrictions. So after liposuction surgery, I'll tell patients that they can start showering 24 hours after surgery and really just take a normal shower like you normally would. Let soap and water kind of run down your body, rinse your body just like you normally would. What I would tell them is don't do any kind of heavy scrubbing because areas are going to be sore and it might cause them a little discomfort. Really the big thing that I tell patients after surgery is no baths, because even though we make very small incisions for liposuction surgery, I really don't want them sitting in a pool of water. So really just kind of your normal soap and water rinse shower.